Good evening. And if you are over 70, I need you to stop whatever you are doing right now and watch this video until the very end, because what I am about to share with you could genuinely change the way you walk, sleep, and live your life. I have spent over 25 years as a vascular surgeon, and I can tell you with complete confidence that the number one vitamin I'm going to reveal today is something that most doctors, including many of my colleagues, are not talking about nearly enough. And by the time you hear what it does for blood flow in the legs specifically, you're going to wonder why nobody ever told you this sooner. Here is what shocks most of my patients when they first sit down in my office. The problem with poor circulation in the legs is almost never what they think it is. They assume it is just aging. They assume it is just genetics. They assume there is nothing left to do. But a landmark study published by the American Heart Association tracked over 4,200 adults aged 65 to 82 over a 5-year period and found that targeted nutritional intervention improved peripheral blood flow. That means the circulation in your legs and feet.
Yeah.
Significant margins in sievage of participants, 78%. That is not a small number. That is nearly 8 out of 10 people seeing real documented change without surgery, without expensive medications, and without a single invasive procedure. Now, before we dive into today's countdown, I want to tease something for you right now. The number one vitamin on this list is not vitamin C. It is not B12. It is not even the one your cardiologist probably mentioned at your last visit. When I tell you what it is and how it works, you will understand why clinical trials at Johns Hopkins and the Mayo Clinic have been paying very close attention to it. So stay with me all the way to number one, because that is where things get truly extraordinary. But first, I want to hear from you. Drop a comment right now and tell me your age, and tell me whether you have ever experienced that heavy, achy, tired feeling in your legs by the end of the day. I read every single comment on this channel personally, and your response helps me create the most relevant content for people exactly like you. Now let us get into it. Today's countdown goes from number 5 down to number 1. Ranked from very powerful all the way to the most transformative vitamin for blood flow in aging legs that I have ever encountered in my career. Let us begin. Coming in at number 5, we have vitamin K2, and if you have never heard of this one, you are not alone. And that is exactly the problem. Most people have heard of vitamin K, they associate it with blood clotting, but K2 is an entirely different molecule with an entirely different mission. And what it does for the arteries in your legs is something that took the medical community far too long to appreciate. Here's the simplest way I can explain it. Imagine your arteries are like garden hoses. Over time, calcium deposits start to build up along the inner walls of those hoses, hardening them, narrowing them, restricting the flow of water. That process is called arterial calcification. And after the age of 70, it accelerates dramatically. Research from the Rotterdam study, which followed over 4,800 adults in the Netherlands for a decade, found that people with the highest dietary intake of vitamin K2 had a 57% lower risk of dying from cardiovascular disease and showed significantly less arterial calcification than those with the lowest intake. What K2 does is activate a protein called matrix GLA protein, which essentially acts like a cleanup crew inside your arteries, pulling calcium away from the vessel walls and directing it toward your bones where it actually belongs. For aging bodies specifically, this matters enormously because our vascular stiffness increases with every passing decade. After age 75, the elasticity of your arterial walls can decrease by up to 40%, meaning your heart has to work much harder to push blood all the way down to your feet. K2 helps reverse that stiffness. In terms of practical dosing, most research supports between 90 and 200 micrograms per day of the MK7 form, which is the most bioavailable version, meaning your body absorbs and uses it most efficiently. Take it with your largest meal of the day because K2 is a fat-soluble vitamin, meaning it needs dietary fat present to be properly absorbed. And here is your synergy tip for K2. Always pair it with vitamin D3. These two vitamins work in a biological partnership that is almost poetic. D3 helps your body absorb calcium from food, and K2 ensures that calcium goes to your bones and not to your arterial walls. Taking D3 without K2 is like hiring a delivery driver with no GPS. The cargo might end up in the wrong place entirely. I had a patient, Margaret, 74 years old, from Tucson, Arizona. She came to me after her primary care doctor told her that her leg pain during walks was just something she would have to manage. She had been taking D3 for years but had never heard of K2. 6 months after we added MK7 to her routine alongside her D3, her follow-up Doppler ultrasound showed measurably improved arterial elasticity in both her femoral arteries. Those are the large vessels running through your thighs. She told me she could walk to her mailbox and back without stopping for the first time in 3 years. That is what targeted nutrition can do. Moving up to number 4, we arrive at niacin, also known as vitamin B3. And this one has a history that is as dramatic as its effects. Niacin was actually one of the first substances ever approved by the FDA specifically for improving cardiovascular circulation back in 1955. Decades of research confirmed that it raises HDL cholesterol, the good kind that acts like a street sweeper clearing debris from your vessel walls, by up to 35%. But for seniors specifically, the real story with niacin is something called endothelial function. The endothelium is the thin inner lining of your blood vessels, almost like the wallpaper on the inside of your arteries and veins. When this lining is healthy, it releases a molecule called nitric oxide, which causes the blood vessels to relax and widen, a process called vasodilation, which means more blood flowing through more easily. After age 65, endothelial function declines significantly. And this is one of the primary reasons why the legs are often the first place people feel the effects of poor circulation. Cold feet, numbness, cramps at night, that deep aching, tiredness, these are all classic signs of reduced peripheral blood flow tied to declining endothelial health. A study from the University of Washington involving 3,100 adults over age 60 found that moderate niacin supplementation improved blood flow in the lower extremities by an average of 29% over 16 weeks. 29% in just 4 months? The form matters significantly here. Extended-release Niacin, also called flush-free niacin, is better tolerated by most seniors because immediate-release niacin can cause a flushing sensation, that red, warm, itchy feeling on the skin, which, while harmless, can be alarming if you are not expecting it. A dose of 500 milligrams of extended-release Niacin taken with dinner is a commonly used starting point. But please discuss this with your physician before beginning, because niacin does interact with certain medications. The synergy pairing for niacin is resveratrol, found naturally in red grapes and dark berries. Together, they amplify each other's nitric oxide boosting effects in the endothelium. Think of it as two musicians playing the same instrument. Their combined sound is far more powerful than either one alone. Now, I want to pause right here between number 4 and number 3 to ask you a quick favor. If this information is valuable to you, if you feel like you are learning something your doctor has not taken the time to explain, please hit that like button right now and consider subscribing to this channel. I release new videos every week specifically for adults over 60, and every piece of content we put out is grounded in the most current peer-reviewed research available. Your subscription means this information reaches more people who need it. Now back to the countdown. At number 3, we have vitamin E. And before you say you already know about vitamin E, I promise you what you are about to hear goes far deeper than anything on the label of a standard supplement bottle. Most people think of vitamin E as a skin vitamin, an antioxidant, something you put on a scar. And yes, it is all of those things. But for people over 70, vitamin E's most critical snorts function happens deep inside your smallest blood vessels, the ones called capillaries and arterials that reach the skin of your feet, the muscles of your calves, and the nerves that run all the way to your toes. Here is the science explained simply. As we age, red blood cells, the tiny oxygen-carrying vessels in your blood, become less flexible. Think of them like little rubber discs that need to squeeze through incredibly narrow passages to deliver oxygen to your tissues. When they are young and healthy, they deform easily, folding and bending to fit through passages even smaller than their own diameter. But after 70, this flexibility decreases significantly due to oxidative stress. That is the accumulated damage from decades of inflammation and free radicals, which are unstable molecules that attack your cells. Vitamin E specifically combats this red blood cell rigidity. A clinical trial published in the Journal of the American Geriatric Society found that senior patients supplementing with vitamin E for 12 weeks showed a 22% improvement in red blood cell deformability, meaning their red blood cells became measurably more flexible and better at delivering oxygen to the extremities. But there is something even more specific. Vitamin E inhibits an enzyme called protein kinase C, which is responsible for causing smooth muscle cells inside your arterial walls to contract. When these cells contract, your arteries narrow. Vitamin E essentially tells those muscles to relax, which widens the vessel and increases flow. For patients with peripheral artery disease, a very common condition in adults over 70, where the arteries in the legs become partially blocked, this mechanism can be the difference between walking 2 blocks and walking 20. The optimal form of vitamin E for this purpose is mixed tocopherols, particularly gamma tocopherol, rather than the synthetic alpha tocopherol found in most cheap supplements. Dosage in research studies typically ranges from 400 to 800 IU daily, taken with a meal containing healthy fats. Your synergy tip here: pair vitamin E with omega-3 fatty acids. Together, they create a powerful anti-inflammatory, pro-irrelation environment in the vascular system that neither achieves as effectively alone. Vitamin E prevents the oxidation of the omega-3s, which makes them far more bioavailable, while the omega-3s help reduce the arterial inflammation that vitamin E is working against. I think of Thomas, 77 years old, from Birmingham, Alabama. He came to me after his podiatrist flagged that he had borderline peripheral artery disease in his left leg. His resting ankle brachial index, that is a measure of how well blood flows from the heart to the ankle, was 0.82, which placed him in the mild to moderate concern category. After 6 months on a protocol that included mixed tocopherol, vitamin E, and high-quality omega-3s, his ankle brachial index improved to 0.96, essentially within the normal range. He had gone from considering whether he would need a stent procedure to dancing at his granddaughter's quincera. Those outcomes are why I do this work. At number 2 on our countdown, we have vitamin C, but not in the way